I'm Jenny McConnell. I'm here visiting gorgeous Yamba, and I'm doing a course for the Optimum Allied Health team.
Optimum Allied Health is on a mission to make allied health more accessible to regional Australia. We're on a mission to deliver 1 million individual health consultations by 2024. We're changing the perception that jobs in regional areas don't have the same opportunity for clinical and professional development as those in the city. The way we overcome that is by investing in world-class presenters like Jenny McConnell, who's here with us this weekend in Yamba and presenting her McConnell approach to the shoulder problem course.
Shoulder issues are tricky for a lot of therapists to treat, so what we're trying to do is really look at the overall picture of where the symptoms are coming from, really realise that it's a global issue, that you need to look at the thoracic spine, lumbar spine perhaps, and make sure that you get that moving before you start to get some control through the joint itself. The important thing is making sure the patient has no pain, so learning a whole lot of strategies about how to unload painful tissues. My background, I'm a musculoskeletal physiotherapist. I have a graduate diploma in musculoskeletal physiotherapy. I'm a fellow of the Australian College of Physiotherapy. I've got a master's degree in biomedical engineering, which helps understand some of the clinical principles, but all of that sort of started when I was interested in biomechanics. How I got to here and doing shoulders is it started off with the knee. So when I was looking at knee issues, and I realised that there are other joints that are very similar to the knee. So the knee being the patellofemoral joint, and the reason I got involved in that quite early on in my career is my younger sister was an elite athlete, so she was state level, and she had to stop all her sport because of her knee pain. Working with high profile athletes is, as a physio, is quite exciting in some ways because they push you to a level that you don't normally go. A couple of the Australian ones, Pat Cash, Pat Rafter. Certainly also been lucky enough to work with Roger Federer. And I'd have to say that elite tennis players are actually really, really genuinely nice people and great to work with, and usually very appreciative of what you do.
My name's Astrid. I work for Optimum Allied Health as a physiotherapist.
Ben Gwilliam, I'm physiotherapy team leader at Optimum Allied Health in Ballina.
Hi, my name is Chantal. I'm an exercise physiologist from Optimum Allied Health.
My name's Jacob Hughes. I'm a physiotherapist with Optimum Allied Health on the North Coast.
I've learnt to do some different taping techniques that I didn't know before, and just learning how to approach and look at the shoulder in a different perspective.
At the course this weekend, we've learned a lot of different techniques to deal with different parts of the shoulder, so different types of pathologies about the shoulder and how we can best treat that with strapping, manipulation, and also exercise therapy.
I've heard lots about Jenny McConnell's courses, and I'm really glad to be able to take part in one in such a small group environment.
It's definitely changed a lot of the way I would actually approach a shoulder case.
To access these courses, generally we've got to go to Brisbane for a weekend or to Sydney for a weekend.
It's actually quite valuable to have Jenny to come all the way out here and Optimum to put on the course for us. It's fantastic.
I feel very strongly that people should come to regional areas to support regional places because it's expensive for regional people to come to the city. I feel that if you want to support the profession and support people in country areas, you should go and help them. So it's really important. Physiotherapy is not just a city problem, it's all around the countryside. Bottom line is we want to really make the patient's journey through their health problem as easy as possible.
We're about creating a great environment where you can do your best work and have access to world-class professional development and mentoring in areas that health professionals can afford to get ahead. Optimum Allied Health, we're a regionally based allied health provider, and we have physiotherapists, podiatrists, dietitians, speech pathologists, physiotherapists and exercise physiologists, and we cover the north coast of New South Wales and into southeast Queensland with our own clinics, gyms and remote services to the community.
I just love it. It's a great profession, and one One of the things that I think that you have to realise is you must listen to a patient. If you listen to their history, it's a very privileged position to be in, that you can become part of their lives.